This is CLC Group 5 with Assisted Death or Euthanasia Practices by Jenna Baker, Kaylee Thomas, and Sweezy Van Dusen. Assisted death and euthanasia practices in the healthcare field refer to medical interventions where healthcare professionals help patients suffering from terminal illnesses or unbearable pain to end their life. These practices involve the healthcare team playing a very active role in helping a patient die in a way of their choosing. Physician-assisted death is something growing all throughout the world, and it is a concept that can be ignored. Nurses are impacted because their role is to support the patient and need for autonomy, as well as support patients by advocating for them. This dilemma draws on nurses' personal views and may bring about struggles when trying to give the greatest quality care. The differences between euthanasia and physician-assisted suicide is that euthanasia is a healthcare professional directly administering a life-ending intervention, and assisted suicide is the care provider prescribing a lethal dose of medication, but the patient self-administers the medication to their own life. Some pros of this are freedom of choice and autonomy are individual right. It alleviates pain, chronic or terminal illness. It avoids unwanted prolonged life, such as aggressive therapies or life support like chemo. Psychological and emotional peace with knowing they have control over their own death. And it can make resources for other patients more accessible and affordable because less being used, like chemo again. Some cons against euthanasia are religious beliefs regarding life's sanctity. Vulnerable individuals might choose to do so if they feel alone, supported, or like a burden. It could lead to non-terminally ill people doing it because they suffer from mental health issues. There is no going back, there's no reversal or antidote. Physicians make an oath to do no harm, so this would be an ethical burden for them. And it potentially sets up patients for inadequate end-of-life care. Our group decided that we were against euthanasia. The methods include involving the patient in the care, granting them full autonomy, treating patients with empathy and compassion, and respecting the patient's belongings, values, and belief. Terminally ill patients often feel undignified. It is very important for healthcare workers to do everything possible to these issues so the patient can maintain their dignity without resorting to terminating their life. Then it is still homicide. Part of being a healthcare professional is to promise to do no harm. Even if homicide was committed out of sympathy, a homicide is nonetheless nothing more than a homicide. And then patients not be fully aware of the decision they are making. The patient's health state affects their ability to think clearly, making decisions, and sees past their current predicament. Our rationale was that it's a slippery slope. It's a potential for regret from patient, the sanctity of life, and the moral responsibility. If assisted death is legalized or more normalized, it can take criteria of who qualifies becoming broader. This raises ethical concerns about autonomy and those easily coerced and free will. The potential for regret. The reality of assisted death is that it is irreversible. The patient is in a lot of pain, physically, emotionally, or both, that lead them to even consider this outcome. If patients make this decision under duress, it raises the ethical question of whether it is truly informed and autonomous decision. For the sanctity of life, many people hold life itself to a high value. They view life as sacred and believe it cannot be ended by human intervention, no matter the circumstances. If life is viewed as sacred, assisted death would be seen as morally wrong. And then for moral responsibilities, healthcare providers have a role to protect life and heal those who are sick. Assisting in death directly contradicts this role. If they participate in ending life, it can be interpreted as them abandoning their promise to do no harm. The ANA Code of Ethics has two provisions that support our stance. Provision 1 states that although patient autonomy is important, then its duty is to protect everyone's rights, dignity, and well-being by providing compassionate oral care that puts life preservation and suffering relief first without sacrificing the sanctity of life. This discusses the importance of patient autonomy while also prioritizing the nurse's duty to provide care that preserves life and reduces suffering without taking life. It shows how unethical euthanasia is because it goes against the nurse's responsibility to preserve life. Provision 6 states that nurses are committed to creating and sustaining an ethical environment and culture of civility and kindness, treating all people with dignity and respect. It urges nurses to work collectively to promote the ethical standard of preserving life. Participating in euthanasia or assisted death might undermine the collective ethical framework aimed at fostering life-sustaining care, compassion, and patient protection. The Nurse Practice Act of Arizona also supports our stance. In paragraph 7, it states any conduct or practice that is or might be harmful or dangerous to the health of a patient or public is against the nurse's scope of practice. It also says that we must provide for the maintenance of a safe, effective nursing care that is rendered directly or indirectly. And then it also states that assisting individuals and groups to maintain or attain optimal health by implementing a strategy of care to accomplish defined goals and evaluate responses to care and treatment. It does not allow nurses to participate in actions that intentionally harm a patient, which includes taking steps that lead to death. Engaging in euthanasia or assisted death could be interpreted as a violation of this rule. It also emphasizes that nurses must act in ways that promote patient safety. Participation in euthanasia or assisted suicide could compromise patient safety, especially if the decision is not made with full informed consent or is influenced by factors such as emotional distress, family pressure, or inadequate counseling. These responsibilities all illustrate how euthanasia and assisted death is against the Nurse Practice Act in Arizona, because it goes against a nurse's duty to promote the safety and well-being of a patient as well as maintaining a patient's optimal health. And then for the peer-reviewed articles being of our stance, euthanasia and assisted death is unethical because it goes against the healthcare provider's duty to preserve life and doesn't consider the ingrained dignity of human life. For instance, even with patient permission, focusing only on the value of life rather than acknowledging its worth carries the risk of justifying euthanasia in non-terminal situations and can result in unlawful practices. And physician-assisted suicide and euthanasia are acts of ending life like homicide and cannot be justified only on the basis of the desire to alleviate suffering, even though they may be motivated by compassion. This shows that even when it's done with good intentions, euthanasia is not ethical because nurses and other healthcare workers have a responsibility to preserve life without compromising the sanctity of life. Thank you for listening to the presentation.